you're not here to listen to me. I know that. I've been told that many, many times. So what I really wanted to say is that it's been a very, very long time since we've had a locally run clinic and also a pharmacy in town. And that's about to change soon, I hope. Thanks to our next guest, ladies and gentlemen, Melissa Mertz.
Okay, here we go. Many of you know me, some of you may not. I'm Melissa Mertz, and I'm a nurse practitioner. And I would say about a year or 2 years ago, my husband looks at me and he says, you know what you should do? You should buy a building and open your own practice. And I thought, and he goes, you know, that way you can live here until you retire, and when you retire, you can rent it out to someone, and we can have a nice clinic. And I go, okay, that's a good idea. So then I just text David Learned, and 3 days later, I called my husband. I said, guess what? I put a bid on a building. He's like, wait, what? I thought we were going to talk about it. And I was like, no, you said it. It's a good idea. So it'll be 2 years, March 6th, that the building closed. And of course, the Avons and, they owned the building first. And I'm just very pleased to be able to have it now and turn it into a community asset once more. So I guess what I'll start with is the plans for the building, and then we can kind of go into some little nitty-gritty details. But we did add on to the building in the back close to the river for the pharmacy. And the reason for that was because I knew right away I wasn't going to be able to do all of it myself. So I was in contact with Kauea, obviously because of my husband. So I was working with the pharmacy there, and I was hoping that they would rent the space from me and run a pharmacy. And we went back and forth for several months, and then finally, once we decided on some things, they said, no, we can't do it, it's just not feasible at this point. So I had already set up for my practice to be a non-profit practice. My goal for that was that I would be a non-profit primary care clinic, and that I would in turn, use that for community benefit, and it would help me, essentially become a rural health clinic. So I had already set that piece up, and when it turned out that I would have to run the pharmacy, I had to then transfer that nonprofit. So the pharmacy is a nonprofit organization, and because I'm a provider, I actually had to step off the board. So even though I did start the nonprofit, I have nothing to do with it anymore as far as being on the board. I'm just more of a clinical advisor, and they will be my, I will be the landlord, which I've never been before. I've never been a landlord, but then I'll be the landlord of the pharmacy. So this is Main Court Pharmacy, and we anticipate opening maybe in 3 or 4 months, so we're hoping in June. It is a very long process, and my part has been a very long process. I knew it was going to be hard, but I did not think it would be this hard, and I did not think it would be this expensive. So back to the nonprofit, when I noticed that my construction expenses were over 100% of what we estimated with my contractor, that I couldn't really afford to have it be a nonprofit because I need to be able to collect any profit that I get right away so that I can pay some of the debt back. So it kind of worked out the way it was supposed to, I guess. So now my primary care clinic is a corporation. Dr. Roach is my medical director. By California law, in 2026, I do not need an MD with me. Right now, the MD is not necessarily with me. What it is the MD and I are in a group together. So Dr. Roach and I are a group called Sierra Family Practice Partners. It's a professional corporation. And then we have a doing business as, or a fictitious name, Sierra Family Practice. You know, I'm on Sierra. I didn't want anything with my name in case I sold it. I didn't want anything in Three Rivers in case we expanded, because I already have expansion ideas into Lemon Cove, but that's a whole nother story, whole nother provider also. But, so I wanted it something that was quite generic. Now that I have the name, I kind of wish I had something called Sierra Family Care, but it's too late. I'm in. It's too far in, so here we are. So the clinic will be, eventually I'm trying to become a rural health clinic. Even though it is a for-profit corporation, I still do plan to have a rural health clinic status. What that does for the community, I'm hoping that it does bring some specialists to the community, and it also helps with reimbursement. It's a scary, very, very scary time right now to be opening up a clinic with all of these changes to Medicare and Medicaid, as I'm sure you can imagine, which obviously 2 years ago, we hadn't known this. And I'm not going to lie, there have been times this year where it got really hard and really expensive, and I just thought, oh gosh, am I stupid? Am I really that dumb that I just did this? But then I would remember my patients and how great it was how great it is to be up here. And I said, no, it's definitely been worth it. So finally, we were able to move forward with the Medicare application because the building was becoming ready. And of course, I'm sure everyone knows construction. You know, I hoped for October, and then it was November, and then December, and finally we got approved at the end of January. So January 31st was the day that I finally had the occupancy certificate from the county. So I couldn't apply for Medicare until then. So I have finally applied for Medicare. So technically I'm open. So it does, you know, you'll see people there, but I'm not seeing patients because I can't afford to just sit there and not be able to bill. So the CMS, the government agency, basically says that I have to be open, but I can't bill for patients yet, but I just need to be open so they can come inspect me, and then after they approve me, then I can start to bill. So it's very complicated. So I've had to time it just right. I have been working for Dr. Solonic down in Visalia, which I know she actually has several Three Rivers patients, so it's been kind of fun to see some Three Rivers folks down there. But this week is my last week for her, and then as far as full-time. And then in March, I'm only working in the mornings for her on Tuesdays and Thursdays. And I do plan to open up to see my Medicare, straight Medicare, on the 5th. So my intention today was to have good handouts for you, but my team that works in Long Beach, they're kind of my organization that helps to organize a medical group. They don't have it ready for me, and I begged them, I said, please have it ready for tonight. So I'm going to push to have it tomorrow so that Wednesday, anyone can drop by the clinic and grab a packet and fill out the forms, and then we'll start to schedule. You know, my initial visits will be longer because it's going to kind of go, you know, we'll go through histories and a reintroduction of ourselves. And of course, it's going to be a lot of, how are you, and I miss you, and what have you been doing, and what have I been doing, you know. But I do hope to do that starting next Wednesday. Now, of course, everyone knows and loves Nicole, and she has been gone from Family Healthcare Network for quite a while. So she is also going to be back with me on a part-time basis. So she'll be working with me in the mornings, getting the schedules together, working on some referrals. She'll be drawing blood. I hope she remembers how. But no, so I'm really happy to have the team back together. As I said, this has been now a 2-year process, and gosh, I had no idea it would take this long. Now, there are differences between Family Healthcare Network and what I'm doing. One, obviously, is that I am a private a doctor's office, a private entity. Family Healthcare Network is what's considered a federally qualified health clinic, and that entails them, for every single site that they have, the government gives them $650,000 per year just to be open, whether they see one patient or 1,000. So they will be fine, because I know people have asked me, well, what about Family Healthcare Network? They will be fine. They have been fine without me, and they will continue to be fine without me. I personally was not able to continue to work for them because it was very, very hard. They had such productivity standards that I had to meet, and I just felt like I couldn't give, when I gave so much to my patients, either I was not being fair to myself or I wasn't being fair to the patients. And in my clinic, in my scenario, the way that I want to do, I want to have a good quality life where I'm not overworked. And I want my patients to actually feel like I have time to be with them and that they're not just a number. So that's the whole dream of what my place is about. Now, I know some people have heard that I'm doing some cosmetics on the site, and yes, that is true. And mostly because it's fun and it is a good way to make cash. I had no idea how much the renovation would cost. It actually cost more than the building itself. So I am using some of that cosmetic stuff to help supplement the income to pay for the bills. So it's just little things. I'm not, we're not doing LA there. We're just doing some facials. Sauna, people who know Sauna Sargent, she's going to be here working there. And it's, I would say, geared for, natural. I call it natural beauty. So, some lasers and some skin tightening, but nothing crazy. So it's not one of those like LA spas or anything like that. But yes, so I do have a component there because I know some people have had some questions because they've heard that. I plan to have the lab draw, the same EKGs, basically a lot of the same services that Family Healthcare Network had for the patients. I hope what I have that is better is, communication and referrals, processing times, things like that. One thing that has been really hard for us when I was at the clinic was phone lines. So the phone lines were really hard for patients when they went away. But before they went away, they were really hard on the staff. So we've been really trying to come up with a way that will help both the staff and patients be able to get access and phone calls. Let me see. So I think that's about it. It is going to be, as I said, a rolling opening. So right now I will have just Medicare, not Medicare Advantage, but straight Medicare. My Aetna contracts are ready. Most of the bigger players like United and the Blue Shield and the Blue Cross, those require that a Medicare application and my Medicare number is assigned. So once that number is assigned, then I can move forward with the rest. And that includes the Medicare Advantage. So that's the Medicare HMOs where they have to have a doctor assigned. So it is right now limited, but we expect in the near future that will happen. And when? I honestly have no idea. They tell you have to be open for 30 to 120 days. I'm hoping it's 30. I'm praying it's 30. And then once we have that and I submit it to the other companies, some take 30 days, some take 60. So it's a rolling, slow opening. In the meantime, I'll just be working as hard as I can to treat whoever I can. And I do hope to have some sliding scale so that those who maybe, we don't have the insurance, we can work something out. And then for people who don't have insurance at all, that's also going to be an option. Medi-Cal for the younger folks will be coming soon as well. So it's a rolling process. I hope to have a real grand opening when we have the pharmacy grand opening. We plan to do that about 2 weeks before the opening because we assume people will want to come in and take tours, and we don't want medication. And I know it's not like everyone's going to be stealing a bunch of lisinopril or atorvastatin, but still, we don't want the medication in there while patients tour. But yes, I hope that we'll be having a tour and a grand opening of that probably in May. And then as things get going a little bit more, I do plan to do some first Saturdays. Right now, I have Nady Spencer, who I'm so thrilled to say. I have several of Nady's paintings in the building, and they are all going to be for sale. So I'll have little signs on them, and then probably some QR codes so that people can ask for those. The other art that I'll have is Wendy McKellar, and then Jack Bratcher has some photographs, and there's some other, C. Helton, she'll have some photographs in there, and they'll all be for sale because I just hope to have more of a community presence, and that's why it's a great spot for First Saturday because whoever's in there can showcase some of their art. Of course, that's commission free. I'm not taking a commission, but I feel like it's a win-win because I get to look at these beautiful pieces of art, and then hopefully artists get to sell some of their work. At least have it exposed so that other people can, maybe look on their websites, things like that. So, and of course, the pharmacy will have some of Nady's paintings, and I'm excited about that because I'm hoping, we'll get some travelers and someone will say, I really love that painting. I want it at my home, so let's see.
Are you able to now take non-Medicare patients with private insurance?
It depends on the fund, it depends on the insurance. Most likely, I'm going to say probably not, because most of them, so say like the United Healthcare and the Blue Cross, the Blue Shield, the Anthem, they require that the Medicare get approved first. So any Aetnas I can take right now, and then key medical HMOs for the Blue Cross and Blue Shield I can take.
Does the Medicare include the supplements?
Yeah, so I'm not gonna lie, I'm trying to figure out how that works. So what happens is I can see the Medicare supplemental, and then I submit to Medicare, and then after the fact, they worry about the supplemental. So I'll still see those patients that have straight Medicare, and then the supplemental picks it up or it gets written off, and I don't exactly know how all that works. So what it is I do have a team in Long Beach, it's called an MSO, it's called a Medical Service Organization. So they do my billing and my HR and my insurance processing, and it's basically like being part of a great big provider network, but you're by yourself. And so they handle all of that stuff. So let's say like if I were a doctor that worked for Korea, it would be sort of like that. So like I'm under that umbrella. And so they'll figure that out. They do that for me. But essentially, whatever you would pay, if that's $0, then it's $0. If it's a $5 copay, then it's a $5 copay. They do it just like that. They work it out after the fact. It's called retro billing, and it takes months to do. And so if I see you, let's say I see you right now, and your Medicare pays, let's say $50, and then your supplemental pays another $50, and you don't pay anything, then that's what it would be for you. And then if you pay nothing for Medicare, but you pay $20 for your supplemental, then that's all it is. And the billing team works that out several months down the road. So I don't have income coming in, that's why I'm still working on the other doctor for now, just to help squeeze me by.
I have a question. Say a visitor was in Three Rivers visiting us.
Mm-hmm.
Would you take
Absolutely.
a private pay?
Of course, oh, absolutely. So in a perfect world, all of the contracts will be open, and I have a very long list of contracts that I will be of insurance companies that will be contracted with. So eventually, say 6 months down the road, it won't matter what anyone's insurance is, I'll be taking all of them. In the beginning, yes, I have to work it out because I won't take it, but then also, like I said, I will be doing some cash pay patients as well, on a sliding scale, very similar to the way that Family Healthcare Network did. But it takes a while for those contracts to come. So.
Peter, go ahead.
No.
So you're saying that after your Medicare is established, then there'll be a certain time before, like say in my case, Anthem Blue Cross of California, Northern California Laborers, my supplement, it's secondary to my Medicare. Yes, I am now. So you're saying that's going to take a while before you.
So as long as you have the straight Medicare, I'll be seeing you.
Okay.
If anyone wants to see me starting in March, starting next week, as long as they have straight Medicare, that's all that matters. Right now. As long as that's the primary. So if you have an HMO that is primary, then the contract has to wait a little bit, except for Humana. I can see Humana with Key Medical. And I think they have like WellCare or something like that. But because they know me, they're local, so I was able to get that contract very easily because Dr. Roach already works for them. So anyway, if you do have straight Medicare as your primary, I will absolutely be able to see you, and it won't be you won't know the difference. It's only my team that knows the difference.
I don't understand. Is straight Medicare meaning you don't have Advantage or another supplement?
It means you
Just
don't have
no,
Advantage.
It
just means you don't. It means you have the little paper card.
that's fine.
Patty, you're fine. She says.
If I come in with my Medicare and Anthem, it's the same as it would be at the clinic.
Yeah.
Okay.
Yeah.
Okay, thank
The
you.
only Medicare that I can't see are the Medicare HMO Advantage.
Okay.
So for example, I'm gonna say it out loud, okay, so Navy Spencer, I looked at Navy's, and Navy's I couldn't see yet because of that contract. But let's say Patty, I could see you. But I don't expect you guys to know that. So if you wanna come and see me, I'm gonna have everyone, we'll take copies of the insurance company, and then we'll let you know. And also, here's the thing, I'm not gonna turn people away either. Like, if you need to be seen, I'm not gonna just say, no, forget about you. Like, we'll work something out, But, yeah, it is, the insurance is so long and so complicated.
It's complicated.
Yeah, I knew it was going in, but I'll tell you, it's even harder now that I'm in it.
Well, we've all been patiently waiting.
I know, and so, well, I appreciate it, and honestly, like, it hurts my heart that it's taken so long, because really, as Nicole, we were like, okay, October. And then, and construction came and lagged, and it, things happen, and it wasn't Jed's fault, but it's just, that's what goes on. And then we were hoping, okay, December at the latest, because I wanted to make sure for the open enrollment that I would have everyone. Well, what happened was, I had Dr. Daniela Ron-Roscoe, and she was fine. She had been working for Kaweah, and then she quit Kaweah, which is fine with me, but she went to work for a place called Living Water, and they didn't want her to be my medical director. So it was fine if I did, but they didn't want it, so she had to back out. And then I had to hurry up and rush to get someone, and then I found Dr. Roach, which actually Dr. Roach was her mentor, so it's kind of nice that I have him. And he graciously agreed, but then it takes time to get all his stuff together, and so that's also why, had this been a better, had I not been so delayed with Dr. Daniela, I would have already been seeing patients by now, but I just had to accept that we had a delay, and, but now we're here.
Does Dr. Roach have hospital privileges at Kaweah?
He does, but I will tell you, there are almost no doctors anymore that do that. It's a dying breed. So.
You have to go through the waiting room like everybody.
Oh, yes. The waiting room.
I have two questions.
Yes.
Yeah.
The first one is the pharmacy going to be open to the public? Like,
Oh,
other
pharmacy
than your
is,
patients only?
oh,
Because I know for Family Healthcare Network, it was only Family
thank
Healthcare
you,
Network.
and that's a really important
Now, my
thing.
second one is, are we going to offer $10 medications?
Okay, so I wanted to be able to offer the $10 medications, but because we are not a federally qualified health clinic, we cannot at this time. This is a nonprofit, so I am going to have some fundraisers, and I'm hoping people will open their wallets to it, because it is for the community benefit. The other thing is once we have the pharmacists and we have the pharmacy open to the public. It will be open to absolutely anyone, not just Three Rivers residents, and not just my patients. It will be open to everyone in the community. And I really want this to be known too. If the community doesn't use the pharmacy and we can't sustain it, then it will close and no one will come back. That's the truth. You know, for us to even get this far is very hard, and I've had other people look at it too, and they said, well, there's no money in it. Luckily, since we're a nonprofit, we don't need to make a profit, we just need to pay the bills. And so as long as we can pay the pharmacist a wage, pay the tech, and pay for the medications. So my goal is, if we do have extra money, that we do start to make a profit, then we would use that money for patients, for their co-pays, so that they could have $10 medications. That's a program that will be later on down the road, but not right away.
Are you gonna have any over-the-counter, is that what it's called?
Yes, yes.
Like
We have a
cough
whole-
syrup and Tylenol and all that?
The cabinetry team just installed a very large
Display.
cabinet in the wrong location, so they're gonna have to tear it off and put it somewhere else. That's okay, but we'll have a large cabinet, not cabinet, but I guess shelving system that'll have all the over-the-counters.
Okay.
Because of course, you know, we want the cough syrups and we want the things that you need to have.
Comfort relief.
Yes,
Yeah.
exactly.
Is that entrance gonna be in the back, or is it gonna be in the front?
Nope,
too?
it's right in the front.
For the pharmacy?
So, you know, there's 2 doors now. So there's 2 doors, and one door is for me and one door is for the pharmacy. Yeah. And what we are looking for is we are looking for two part-timers, because then they can coordinate schedules and someone can be on vacation, someone, you know, that way it can always be staffed. What happens if someone has a child that's sick and has to go somewhere, then we can have someone else come right away. So that's the goal. We're working on it. It is hard. We do have a board of directors that includes 5 individuals from the community. We are going to discuss more about the board of directors in the pharmacy, I think, at another thing. So I'm not going to give any more information about names and all of that until the next meeting, because someone from the board will be up here speaking. And they'll say a lot of the same things that I am. But we are going to send out a little mailer that just lets people know, please. I know we've all gotten comfortable with the mail order pharmacies, but please use the local pharmacy, because it's like all these things. If we don't have enough people using it, then it does go away.
Those providers make it really hard. My insurance, my mailing.
Oh, they do, I know.
They make it really difficult. I get hate letter if I run like 3 scripts in a row. No, antibiotics, painkillers, that kind of stuff.
Yeah.
I can go wherever I want.
Right.
But on my maintenance medications, which is no profit in those, they get really nasty with me if I go to.
So we do plan to work on getting contracts with the plans,
You'll be a network.
so that we can be in network for people. That's what we're working on for that.
Do you know how your prices at the pharmacy will compare to those at Costco?
I don't. I mean, we will be trying to get the very cheapest cost that we can. You know, we're hoping though that, like, okay, so if it's 10% more, that means it's, you know, $8 instead of $7.50, that you're not going to waste the $5 in gas to go down there. So, you know, I can't tell you right now, because we just don't know. We haven't been able to purchase anything. However, I do have a purchasing contract already with McKesson, who provides medications, and because, well, I'm going to have to say, I want to say it's because of the goodness of their heart and we're a nonprofit, but that's not true. It's because my husband has a really long relationship with them. And they have, and so we're using everything we can get. And they are guaranteeing us hospital priority pricing, which means we will get the cheapest price that the hospitals would be getting. So that's a good thing.
So, nobody else is going to jump? Okay. The most important question is, will you or the pharmacy be doing the regular vaccinations?
Oh, both. Both.
Both? And will you be able to take back a lot of the accounts that transferred from the old pharmacy over to Rite Aid and
No, people will have to come directly. They'll have to have them,
then they can request it back?
yes,
Okay.
yes, they'll have to.
But you will do vaccinations and RSV?
Oh, absolutely, yes. So my patients will have their vaccinations in the clinic by me, and the patients who go to other doctors can have it in the pharmacy. Absolutely. Yeah.
Melissa, I wanted to ask two questions around pediatric care.
Mhm.
Because you're kind of technically a rural community, clinic, have you been approached to be part of the California Children's Services providers?
So I have not been approached, but my team is working on that, to be a CDHP provider.
I'm on
Yes.
the state committee for it,
Uh-huh.
so.
Okay, yeah, so they are just starting all of that work right now.
I think there'll be a great need for you here,
Yes.
because a lot of the children's hospitals are going to have a cut in funding for
Mhm.
rural outreach, so if the clinic is here,
Yes.
the state would be more apt to go ahead and give you, your license.
Exactly,
Your numbers.
exactly.
It also means more rolling of dollars for you.
Right.
They won't say how much, but.
Right, exactly. Well, and to be honest, every $5
Yeah.
helps.
And my other question was around community support groups. I know there was an Alzheimer's support group here.
Yes.
And from my point of view, because of my work, I would love to see an epilepsy support group. Is in your consideration, have you thought about opening a clinic for those types of groups to meet?
I'm so happy that you said that. So, when I mentioned before that I have this vision of being able to be a rural health clinic and have some specialists, and that I'm also doing these little cosmetic things. Now, me being a primary care provider is my main job, and I plan to do that Monday through Friday. I plan to do that other stuff just on the weekends or in the evening, so that leaves 2 rooms available that I want to have community use. So whether it is through education, someone doing education, whether it's doing support groups, whether it's a specialist, like I would love to get a podiatrist up here. I have a GI doctor who's willing to maybe come up, like these are down the road. Now the reason that it is very complicated as far as the billing and the reimbursement, but as a rural health clinic, a specialist can actually get reimbursed more than if I were a rural health clinic. So that's why I'm looking for that, because I want to hopefully bring some people to the community. But part of my vision is this is not just, it's community wellness, So absolutely support groups, absolutely. I would love to see some type of, I have that back deck, doing some yoga, doing some walking, whatever, whatever anyone has an idea.
We're a part-time tourist town.
Mm-hmm.
How are you set up to handle travelers?
Same way before, I have the skills to do a lot of sutures, and we do assessments, and so we'll take walk-ins and then send them down the hill if needed. But absolutely, we'll be taking those.
Do you have an X-ray machine there, or are you going to send them down the hill?
No, unfortunately, an X-ray machine would be my dream, but the regulation into an X-ray is it's just too impossible.
Crazy,
Yeah, I just couldn't do it, plus I couldn't afford it. I do plan, when I start to make a little bit of money, I do plan to invest and have an ultrasound machine, handheld ultrasound, so I can look at heart, so I can look at abdomen, so that's something that I plan to do. One thing that I have contracted, which I'm really excited about, is something called ID Now, and what this is molecular testing for RSV, COVID, strep, flu. It's the same one that they have in the emergency room, so I'm really excited for that. We'll be doing the finger A1C checks, the blood draws, very similar to what we had before. The one thing that I cannot do, which I was really devastated, was a troponin, because I would love to be able to test a troponin to see if someone really was having a heart attack to send them down the hill. That requires what's called a CLIA, a medium application, and we don't qualify for that. We're too small. So that was kind of a bummer, but I'll at least be able to do something called a D-dimer. So if I suspect that you have a DVT, I can check the D-dimer and see if that's the case. So there will be things that I'll be able to do to rule out having to send someone down the hill.
Does family health care, can they do x-rays? Could you send somebody over there?
No, not to their x-ray facility.
They don't have one?
They don't have one, they do not have one here in town, or the only place they have them is Visalia and Porterville.
Oh, okay.
So, same place that I would be sending anyone here is, I'll be sending you to Visalia or Porterville. Yeah.
I'm curious, you keep throwing out the term, you want it to be a real family health care clinic. And I just-
No, rural health,
As a-
rural health clinic.
We're the bad people here.
Sorry.
Is this as opposed to being a doctor's office? I'm not sure what it.
No, it's a doctor's office. It's just a designation by the government. So it is a private doctor's office, is what it is. The rural health clinic designation just states that because we live in a rural area, we can have different reimbursement rates for specialists. Now, obviously, I am by myself. I don't have any specialists. But having the draw of being able to have a better reimbursement for a specialist to come up here and make more money than they would in their own office in Visalia, I think will draw some people. And then it is different than a federally qualified health clinic. So that is a health clinic where it is different. They get federal funding. So I would not be doing any of that. It is a private corporation. Yeah.
Where would you send people for blood tests or x-rays and stuff like that?
Well, the x-rays, typically it'll be wherever you want it to be, but it will be either Korea or Visalia Imaging, all the same places that you get sent to now. Now for the blood work, it depends on your, insurance. Most people can have blood drawn by LabCorp, so I plan to have them come up and pick it up. But if you want to have it done at Korea, I have Korea orders. If you want it done at Quest, I'll have Quest orders. And all those just go straight into the EMR, and I'll be able to see them like anybody else. Yeah.
You said you are gonna have a imaging machine there.
Well, it's a handheld device, and it is down the road. That's kind of on my 6 to 12 month plan, because right now there's no money in the coffers. So, yeah. But yes, I do plan to have that because I want to be able to check just, quickly for abdominal issues or heart issues. Well, it's nice for other things too, but yes, I do plan to have that.
An EKG?
I have an EKG already. Yep. I have, the scale, all the usual suspects, I think. But yeah.
As you reach each additional milestone, you're able to take this now, you're able to take Medicare Advantage now and whatever. How are you thinking of keeping people informed?
That's a great idea. Right now, the only way that I have is through Facebook, but I plan to ask you to be able to disseminate some information for those who are not on Facebook.
If you're interested, we can have, a little section in the newsletter, in the
But,
bulletin.
if there's any updates, yeah.
Yeah.
And then, I actually, the mailers are really nice and really inexpensive, so my plan is to just do mailers because I think that's an easy way to get to people's homes, whether they look at it or not, that's fine, but just kind of updating on that, yeah.
Melissa, I have a suggestion. There's networks called Family Resource Centers in the state.
Yep.
And putting your name, your practice on there will get to a lot of people.
Oh, that's a good idea.
Working in Sacramento, I know that the rural clinics are really the hot topic
Okay.
because there's not that many of them, or some have gone away because of funding. The other way I would suggest is that you get your name listed officially on the Department of Health Services website.
Yes.
On their dashboard.
Yes.
You might get more calls than you want to.
Well, yeah, that will be coming once we get the licensing.
Once you get it.
Yeah. it's such a weird thing that you have to be open, but you don't have a license, and then you can't bill, but you need to be open. So I have a really amazing volunteer, Donna Quillen, who is, bless her heart, sitting there open, you know, reading books, waiting for this. So in the next few weeks, I know we'll inundate her with some actual patients. But yeah, it's an interesting thing to do it like that.
What is your stand on integrative medicine?
Oh, I love integrative medicine. So that was another one of my ideas, was to, because I have these extra rooms during the day, was, you know, have someone come up. So basically it is me making relationships with some other providers. I know that we have some alternative practitioners here in Three Rivers, and so I'll be inviting some of them if they want to use the space for some patients and put them on. I think that so much of it comes from our diet and exercise, and of course, natural things are very important, and they're usually a good to combine them.
You've already done a 5-star review. Oh wait, that's your husband, smart guy.
Okay, I'm sorry to have to say this, but last question.
What I want to know is, this is a good one. When we come to see you, do we get a cookie?
Well, I want to say those cookies are from Nicole, and bless her for bringing those. That was such a cute surprise. But I am happy to have her back, and I'm so excited to be back in the community again.
You know that as we've been driving back and forth through town, we've been watching every progress. We see the trucks, oh good, they're working inside there. Oh good, they're putting up a handicap.
I know,
Oh,
I know.
look, the addresses on the building, we've been watching every little step.
I know. No, trust me too. I'm like, oh. And then it kind of stalls for a little bit, and then I get a little anxious, like, okay, what's going on? But
Our door, there's some lights out there, like, woo.
yes, that was a nice one
I
too.
know those things.
Okay,
Yeah,
thank you.
Thank you all for letting me share with you this evening. I hope I was not too scatterbrained, I'll tell you. I have really been scatterbrained lately because this has been a very difficult process, but I'm very happy about it. So thank you so much for your support and your love. And telling me that you're waiting for me, it warms my heart, and I love this community.
They just don't want to drive down the hill.
Peter, I know that's the truth, but I still want to feel like it's for me too.
Thank you.
Thank you.
Thank you again. A couple of very quick additional housekeeping things. One, Melissa and I are going to do a follow-up one-on-one video interview that will try and compress a lot of these so that it's a faster watch, and we'll post it. But I'm going to edit this and post it so you can review that. But look forward to it, the one-on-one, which we're going to record it on Monday, I hope.
Yep.
And it'll take a few days to edit, and then we'll post it. And I'll just send out an email to everyone. And for those who don't get email, we'll try and call everyone and let them know that it's available. So that's one. The other one is Melissa is going to try and help me speak with members of the board of the pharmacy and perhaps do the same thing at the next potluck about the pharmacy. Is that okay with you guys?
Yeah.
Okay, so we'll work on having that. I'll try and not make it as last minute as this one. Apologies, she was available, she was willing to do it, and I got all excited.